Welcome to our UAMS DPT information session. UAMS Northwest is a satellite campus of UAMS Little Rock. We are located in Fayetteville, Arkansas, about 1 mile from the University of Arkansas and Razorback Stadium. This information session is to highlight the top 10 reasons for picking UAMS physical therapy. Number 1, we are brand new. Our facilities were built in 2015. A new program means new equipment, new teaching labs, new research labs. We have 14,000 square feet of new space with new equipment to fill it. We have on campus 5 teaching labs for physical therapy and 3 research labs. We have an orthopedic lab, a neuromuscular lab, exercise physiology and cardiopulmonary, electrophysical agents, and gross anatomy. Our motion analysis labs include a gait lab, a motor performance lab, and nerve conduction and EMG studies. Our gross anatomy lab uses prosections instead of dissections. We do this because dissecting is time consuming, and it's not a skill we need to practice as PTs. So at UAMS, we learn from already prosected specimens that are plastinated in Germany. This gives us all the benefits of learning from real cadavers without the mess. It also allows us to spread our anatomy out over 5 separate courses, because there's no need to return the bodies for burial. So you'll study the upper limb as we take upper limb conditions. You'll study cardiopulmonary anatomy as we cover cardiopulmonary conditions, etc. Number 2, we have on-site clinical facilities. Our on-site outpatient clinic is staffed with 9 therapists, not counting our faculty. This gives a place for faculty and students to see patients on a regular basis. We also have an inpatient facility, which is the Fayetteville State Veterans Home, and an on-site interprofessional student-led clinic called the North Street Clinic. Our faculty and students have access to both inpatients and outpatients on-site every week of the curriculum. Number 3, we have an holistic admissions. What this means is that we look at both academic and non-academic factors, such as communication skills, leadership, clinical and life experience. Because our ideal student is strong academically, plus is a self-directed learner, is a problem solver, communicates well with different people, demonstrates maturity, flexibility, and has what Harvard Business School calls grit. We do this because there's more to PT than just the facts. We have to empower our patients. We have to gain their trust. We have to motivate and support them, often in a fragile and sometimes hostile healthcare environment. So we're looking for students with a heart for service and the mind to figure out how best to do that. Number 4, low class size. We average 25 students per class. With 7 full-time faculty and several adjuncts, that means a low student-faculty ratio and individualized instruction. Number 5, our curriculum is built on the principles of active learning. We learn by doing, not by listening and copying down notes from slides. A tenet of learning is that the one who does the work does the learning. So if I work several hours to prepare a lecture that you passively watch, who did the work? I did. Who did the learning? I did. The entire DPT curriculum is built around the concept of active learning. And so we'll flip the classroom when appropriate and utilize problem-based and team-based learning. Lecturing involves the transfer of information from the notes of the lecturer to the notes of the student without passing through the minds of either. Passive learning is not efficient learning. Active learning at UAMS involves flipping the classroom. The traditional model of teaching has in-class lectures with application of the material via homework outside of class. In the flipped classroom, we give the student access to the lecture material, the factual material, at home, which you look at on your own time. And then in class, you do the application activities, often but not always in case-based, problem-based, or team-based learning. Number 6, we have clinical education every semester. This is a major strength of our curriculum, the access to the patients starting in your very first week of classes. Not only do we have inpatient and outpatient facilities and our North Street Clinic, but our system-based curriculum allows you to see patients every semester. This is detailed in more detail in the clinical education information section, but our full-time clinical experiences with our system-based curriculum is spread out over 3 years. This is a snapshot of the curriculum, and what we mean by system-based is that this entire first year in green you will take orthopedic classes, and then at the end of that first year you'll have your orthopedic outpatient full-time clinical placement. Then you'll take the neurological and cardiopulmonary conditions, and then you'll have your full-time neuro and acute care placement. Then in the third year you have either the neuro or acute care that you didn't have and your elective. So we try to spread out the clinical experiences through the system-based curriculum so that the clinical placement is very close in time to the didactic information. Number 7, interprofessional education. UAMS not only supports but requires interprofessional activities for all students in all programs. One of these activities is our student-led IPE clinic, where patients are seen by both pharmacy, medicine, nursing, and physical therapy students, and they see them as a team, assess them, and develop a holistic treatment program. Number 8, we have electives. Students will have some sort of ownership of their education at UAMS by choosing 2 elective courses and 1 full-time clinical internship elective. The electives will change depending on the skills and availability of the faculty, but will include a variety of topics that allow the student to progress beyond entry level in certain areas of interest. Number 9, service learning. Part of the mission of UAMS is to give back to the community. So each PT student must perform a minimum of 10 hours of service every semester of the program. This means that our 72 students or 75 students will give over 700 hours of community service every semester. Each student must also do professional hours, which are spread out over the 3-year curriculum. And number 10, last but not least, we have recess. We cannot effectively learn sitting in a classroom all day. We need breaks. Some of our exercise breaks are structured to practice exercises that relate to the curricular content that semester. Other breaks are just for fun and stress release. Recent sessions have included Tai Chi, yoga, 30-minute abs, and line dancing. To quote a Harvard psychiatrist, exercise is the single most important thing a person can do to improve their learning. And so we break up our lectures with movement. So, is UAMS for you? Are you motivated and self-directed? Active learning and flipping the classroom is not easy. You need to be very self-directed and have really good time management. There'll be no spoon feeding, no cramming from instructors' notes. You need to learn how to learn and how to sift through the ever-changing information that's out there to make the best decision for your patients. Are you interested in interprofessional education, team-based education? Do you want a DPT program that has new facilities, low class size, holistic admissions, active learning, a synchronized system-based curriculum, clinical education every semester, and course electives? Well, then you've come to the right place.